Hi, a very warm welcome to everybody. Good morning to you. Thanks for coming in today and coming in on time. A quick moment for housekeeping announcement. It's 10:32 right now. We have muted the microphones for participants. You can post questions and feedback on the Q&A panel. Let me introduce our speaker today. Dr. Arun Kumar Basavaraj did his MBBS and Masters in Pathology in India. He's a diplomate of National Board holder. He has vast experience in teaching learning in India, Seychelles, and Malaysia. He is ECFMG certified and has guided students to excel in USMLE steps. He's a senior lecturer and head of Pathology Division in IMU. So over to you, Dr. Arun Kumar.
Okay, good morning, everyone. So this is Dr. Arun Kumar, and thank you, Dr. Irwin, for introducing me. And it's my pleasure on my part to introduce Dr. Irwin to you all. Dr. Irwin is the moderator for today's session. And Dr. Irwin Koo did his MBBS in International Medical University. His postgraduate training in pediatrics commenced with Housemanship in Kuantan, and then as a medical officer in Gerantu and Salayang Hospital. He was then attached to Princess Alexandra Hospital in the United Kingdom and completed his membership exam in Great Ormond Street Hospital, London. In 2019, Dr. Irwin was elected to Fellowship of the Royal College of Pediatrics and Child Health. He is member of the Academy of Medicine in Malaysia and is now an associate professor in pediatrics department in IMU.
Thank you, Dr. Arun. So we'll go ahead with your presentation right now, Dr. Arun. Is it okay?
Yes. Right. Once again, a warm welcome to you all attendees, and hope you're all keeping well, especially during this COVID and pandemic and movement control order and staying at home. So one thing is for sure, stay safe and be healthy. Okay, so let's look at this today's talk. And as you can see the title here, the talk is Targeting Beyond MBBS, right? So I guess many of our participants would be looking at getting into MBBS course. But here we are looking at targets beyond MBBS. Okay, so let's have a general idea about this. So on your screen, you can see the profiles of the speaker, that's me, and moderator is Associate Professor Dr. Irwin. So it's not that we are going away from the target. Okay, the title is Going Beyond the Target. So we are not blindfolded. We are looking at the target, but there's something else beyond it. If you think your target is MBBS, think again. Let's look at this. Getting into MBBS course. Of course, you know, you would have had a lot of opportunities, a lot of options for you to choose after your STPM or after your A-levels, foundation. So your opportunities would be quite vast. You don't know whether you want to be in a law, engineering, or medical, dentistry, health sciences, finance. Okay, so that is the actual time when you are, you know, around a lot of perplexities. Yes, you have decided you want to be a doctor. I want to be a doctor. I want to be a MBBS graduate. To become a doctor, you know that there are so many things involved. Your grades matter, your scores, your passion, motivation, your grit. Yes, I am going to be a doctor. I am going to be a medical clinician. Of course, you should not have any time constraints. If you are thinking of settling in life after 3 years or 4 years, you know, you want to earn a lot of money, you want to be happy, you don't want to learn anymore, then becoming a doctor is not your area. You are not supposed to have any time constraints. There are so many things to achieve. So with the medical profession, your learning begins. You are a lifelong learner. And of course, you are seeing this vitamin M. What is this vitamin M? Money, right? Of course, getting into medicine, it costs money. Okay. You will be thinking of scholarship, you'll be thinking of sponsorship, loan. Of course, all these things are there, right? So if all these things fall into place, you end up in a medical course. Of course, the journey of medical course doing MBBS is so exciting. For me, when I was a medical student not long ago, the best time was being a medical student. I had utmost grandiosity, yes, I'm going to be a doctor. So being in a medical school, medical university, learning from faculty, learning from using the resources effectively. If you come to IMU, you see that IMU is such a wonderful place. Your museum, there are clinics, there are patients, there are doctors, there are library facility, so many things. You learn a lot. Of course, medicine also has a lot of cramming, lot of planning, lot of reading. If you think that you can pass medicine just by, going through some of the easy tips, no, there are no easy tips. It's a lot of hard work, right? Of course, medicine involves going to hospitals, seeing patients, hard working, being early in the ward, spending more time with patients, learning a lot. And of course, there'll be a lot of fun. Fun factor is obviously there. Medicine in a nutshell is so many things. These 5 years, you're learning a lot, you're applying to your skills, knowledge, skills. The time comes after your MBBS. If you are thinking that soon after MBBS, I'm going to treat patients, I will be a expert, think again. The situation will be something like this. So much barren, so much of vast, wide area. You don't see the end of the earth. You see there's so many things. The road is long and you have to travel for a long time. So you have become a doctor. Do you think you can start treating patients right after getting a degree? Right after 5 years, can you treat patients? The answer is no. What lies after finishing 5 years in medical school? So I've done 5 years, I've got a degree. You still have to wait for internship or housemanship, and the waiting period can be 6 months to 8 months. There are 2 years of internship or housemanship. In some countries, they call this mandatory or compulsory rotatory training as called internship and housemanship. Then there are 2 years of mandatory government service, and hopefully there is no delay or extension. At that point of time, after finishing all these things, you would be a private practitioner. You would be a medical practitioner. But keep in mind, you are not a specialist. In the current context, with so many doctors coming out, Malaysia needs specialists. We need specialists, right? Let us say if you have a plan that I want to serve patients, I want to occupy a clinic which is run by my family. I have a lot of intention towards caring for patients, treating patients. I'll be just MBBS doctor. That's good. That's a good plan. If your plan is like that, it's fine. But keep in mind, being a specialist is a different ballgame altogether. There's a big world of specialization. Medical fields has grown leaps and bounds. The diseases are not the same as before. There are plenty of advances in science and technology, in pharmaceutical, pharmacy, pharmaceutical technology, so many things, and more specialization have erupted. I'll tell you a short, scenario or a story to introduce you to this concept. Sometime back, when I was a medical student, I was in a medical school. My father had a small trivial accident. He fell and he injured his leg. What do we do? When he injured his leg, he went to his private practitioner, the GP in the locality. And the GP looked at his leg and he said, no, you need to go to a bigger hospital, and go to a hospital, bigger one, where they could give you a much care. So he went to a hospital. He was not able to get treatment from a private practitioner. When he went to a big hospital, he was seen by a surgeon who was on call because it was a case of injury. The surgeon looked at everything and he said, okay, let's get an X-ray done. When the X-ray was done, the surgeon said, oh, the problem is not my area. You have to go to a orthopedician. You have to go to a bone specialist. Okay, the problem as per the X-ray appears to be in your bone. So go to a bone specialist. Or rather, he was in hospital. My father was in hospital. The bone specialist came to him. And that's where I also joined him, because I was a medical student. I was more curious. And the orthopedician on call said that, look, I'm an orthopedician, I'm a bone specialist, but I have left my surgery practice. I don't operate on bones. Your problem needs treatment with surgery. I am referring you to another orthopedician who is doing a surgery. Then the next orthopedician came and he said, look, your problem is in a joint, knee joint. Okay, I am an orthopedician. I fix the bones, I treat fractures, but you need to go to orthopedic specialist who is expert in joint surgery. Okay, look at this. Orthopedic expert in joint surgery. Subsequently, the joint surgeon came and joint surgeon said that, no, I'm a joint surgeon. I open up the joint, but your problem doesn't need open up the joint. Your problem needs arthroscopy, right? You need to go to an orthopedic specialist who is a joint surgeon, who is an arthroscopic specialist. And subsequently, arthroscopic super specialist came. And he said, look, I'm recently trained in arthroscopy. I'm not very confident. Why don't you go to an orthopedic specialist who is an arthroscopist who has recently come from Singapore? Okay, so supposed to have a more experience. Look at all these things. After going through all these things, my father actually had a question. When that Singapore orthopedician came, who is expert in everything, my father asked, are you a right knee joint arthroscopic orthopedic specialist or a left knee joint specialist? Look at the amount of specialization which has happened. There was a time when bone specialists were considered as an end specialty. You do a bone specialist, you become a bone specialist, you need not do anything. But now there is enormous amount of opportunity for any specialist to grow in their field. Okay, so with this background, you can now understand how much the field of medicine has grown. Okay, so there are many core clinical specialties. Okay, so you can see if you just go to any website for any hospitals like Pantai Hospitals, Gleneagles, you have to select find a doctor. You'll see all the breakdown of list. These are the core specialties, or maybe more from them. There are medicine-related specialties. There are surgical specialties. Okay, in general, medicine specialties, they don't operate, they see patients, they treat with medicines. Surgical specialties, they operate. Okay, so you need to decide where do you want to be. Not just as an MBBS doctor, I need to be a specialist. So what it takes to be a specialist? 5 years of MBBS, 2 years of house officer, 2 years of medical officer, 4 years of post-graduation. So a candidate needs to do a post-graduation, or what we call as specialty training. That's when you will be called a specialist. But keep in mind, if you have a passion, if you are determined, if you have grit, you are in the block and you want to become a specialist one day. Okay, so if at all you are thinking that you want to be a specialist in 3 years, 5 years time, no, the answer is big no. So it takes time to be a specialist. But of course, the moment you are in the block, yes, the second year of being a house officer or during the MO itself, your training would have started. Okay, we'll come back to that in a while. And then there is something called a subspecialty or fellowship, or what we call as super specialists. These are experts who have gone beyond the specialty. Okay, I met few fresh candidates, fresh MBBS candidates. I ask them, what do you want to become in your future? One says, I want to be a cardiologist, I want to be a neurologist, I want to be a chest medicine specialist. So students are thinking in terms of becoming a super specialist, but they need to know their path, what it takes for them to be there. Yes, I need to be there. It's not a hard thing. Of course, the world is aging. The current specialists are all going to age. It's your time. You will become specialist, super specialist. But what it takes for you all to be there. There are plenty of super specialists. The medical related subspecialists are like this. You would have heard of many of these specialists, like cardiologists, neurologists, gastroenterologists. Even there is something called pediatric cardiologists, right? It is going beyond what we have thought. Surgery related subspecialty. Okay, so these are those specialists who will be working in their own field. Of course, they are complete doctors, they are specialists, but they are super specialists. Malaysia has very few of these super specialists. Okay, so we need to be there. So super specialists or subspecialty training may take additionally 3 to 4 years or 2 to 3 years, depending on where you are doing this, whether in United States or Malaysia, or whether it's in UK or Australia. Okay, so look at this. This is a very popular, forward message. Most of you would have seen this. This is on Wikipedia. I'm not trying to, be very, naughty showing this picture. In your current context, this is you. Okay, whether you are a female student or a male student, this is you. This is your MBBS. You are present. You are with a MBBS degree. You should look back, not look back, look forward. Look forward towards this. You are a specialist. You to become a specialist. Okay, so that is what we call as targeting beyond MBBS. So let us have a general idea about career options after getting an MBBS degree. Okay, of course, one of the ways is to be a private practitioner in your clinic. But what are the other things? You can become a private practitioner and can have a lot of on-the-job courses, plenty of courses, training courses. Few weeks to few months, you can upgrade your skills. Ultrasound scanning skills, radiology skills, so many skills you can, get into this and then keep on upgrading your knowledge. Of course, there are many online courses, local courses. You can be a specialist doing these courses and practice within the context of the legal system. And if not that, you can do some formal post-graduation or specialty training. It could be a local program, like a master's program in Malaysia, or else Mrcp Uk program, where you are a general practitioner or you are a medical officer and you undergo specific amount of training, you pass some exams, and you become what we call as Mrcp degree holder, member of Royal College of Physicians. Likewise, you have MRC OG, member of Royal College of Obstetric and Gynecologists, and Mrcp CH, Child Health. So with this degree, staying in Malaysia, you could be a specialist working in Malaysia, not necessarily to go beyond borders. There are many overseas post-graduation courses in UK, Australia, USA, Singapore, and all of them have its own constraints. It could be a matter of lack of information. It could be the duration of training. It could be difficulty to get there, visa issues, staying there, working there, family constraints, money problems, so many things. But at least as a future medical graduate, you should know, yes, what options do I have? You go to a restaurant, you get so many things there, right? You have a menu there and you decide on what you want to eat. Just like that, you have a menu on your future plans. Okay, there are other options also. You can work for Ministry of Health as medical officer, keep on working, grow within the system. Each of these has pros and cons. you know, you can be a researcher. You can do masters in science. Okay, there are several masters courses. This is after your MBBS. You can do masters in science. You can do a PhD. You can be a scientist. No, I don't want to see patients. I want to be a doctor, but I don't want to see patients. I can't see their suffering. I want to be a scientist. Yes, this is the right field. You can be a medical officer with a PhD. Think about it. Think outside. Or else you can do some healthcare related post-graduation like medical law and ethics, like masters in public health, business administration, healthcare business administration. Think about those things. Yes, I want to be an MBBS doctor with business administration. I want to have my own set of clinics. I want to manage my hospitals. Why not? Right? So there are so many things you could do after your MBBS. You could be an entrepreneur. You know, nowadays we are talking about why do you want to work for somebody else? Work for yourself. There can be something called healthcare related businesses like running GP clinics or hospitals or nursing homes, hospice centers. You know, we see very small percentage of students giving up everything. No, I don't want to be a doctor at all. This is after doing MBBS, maybe 9 years after MBBS. They go into shipping business, real estate, retail shops, restaurants. If you really want to do this, why did you waste your medicine course, right? So there are plenty of opportunities. Or else think about this. Why don't you be a GP and also do something else? Okay, nobody is stopping you. Okay, so think about it. There are plenty of opportunities in life. And if you have passion towards medicine, yes, this is the right field, but in a proper way. Of course, think about this, non-clinical masters. Till now, we are thinking about post-graduation in all clinical specialties. In all clinical specialties, you think about going and meeting patients, treating patients, and contributing to patient care. But have you thought about becoming a non-clinical masters in post-graduation? That is preclinical and paraclinical subjects. If you don't know what are these preclinical, paraclinical, they are those subjects which are taught in MBBS during the initial 2 years to strengthen their foundation of learning medical course. Doing a specialization in non-clinical area is much in demand in future. It's of less interest among the people. Let us say if I just ask 100 of my 100 or 200 medical students, what do you want to become in future? Hardly 5 or 10 students may say that I want to be a non-clinical master's postgraduate expert. Everybody wants to be a cardiothoracic surgeon, cardiologist, neurologist, pediatrician. Okay, so think about it. This is the area. These specialists are in medical schools. They do teaching. They do research. They work in laboratories. Your graduate priorities need to change. But when is the right time to decide on all these things? It's not at the time when you join MBBS. Probably you learn this during your MBBS course. You learn this while you're working. Yes, what do I want to become? But you should have a target. You should have a goal. Okay, so when you enter a medical school, yes, I want to be a doctor and that's it. Don't think like that. Okay, so there are many things. As a non-clinical masters, you will be in a lab working behind the scene. You'll be working with microscopes. Of course, there are some non-clinical masters who are very much don't like this because they see that I don't see myself as a doctor. You know, I want to go around the hospital with stethoscope around my neck. I want to treat patients. I want to see happiness on their face. But being a non-clinical masters is like working in the basement. Okay, I can't go around holding my microscope along. But think about it. Maybe it could give you satisfaction in life. You might be teaching future students in classrooms. So there are plenty of non-clinical masters, pathologists, pharmacologists, parasitologists, virologists. We are now talking about virologists. Okay, the world is all talking about COVID-19, SARS-CoV, right? Virologists are everywhere. They're much in demand. We need a medically graduated virology specialist who could come and tell us about the viruses, the mutation, the mutant strains, the vaccine, so many things. you could become one. Clinical microbiologist, chemical pathologist, public health expert, forensic pathologist. Have you thought about being in a crime scene, investigating, forensic medicine expert, doing a post-mortem examination? If you have that passion, think about it, right? Don't crib telling that, oh my God, I had my MBBS, I don't know what to do. There's so many things you can do. Okay, so one of the key aspect of this today's talk is to look at these things, non-clinical masters. Why not? Okay, so let us look at some of these pathways. So this talk is not going to the nitty-gritty of these pathways, like where to apply, what to do, what are the eligibility criteria, who can apply. We are just giving you an overview about these various pathways. So Mrcp Uk pathway is something like this. You obtain Mrcp degree outside UK, that is in Malaysia, staying here. The training in the specialty is around 4 years. And during these 4 years, you need to pass 3 exams. 4 years can be part of your compulsory medical officer training. And maybe subsequently, 1.5 to 2 years, you will finish all the training. And subsequently, you would do around 18 months of gazettement. And probably your gazettement period is also within the training period. So after MBBS, maybe around 4 or 5 years, you would be a Mrcp degree holder with a specialist practicing, certificate. So you are a medical specialist staying in Malaysia, practicing in your field of interest. Okay, think about it. And you need to plan for all these things. During your MBBS, yes, I want to be a Mrcp specialist. Okay, I need to take exams. When can I take exams? What exams? What is the component of it? Go and meet people. See, Mrcp Part 1 exam to be taken 1 year after graduation. You can't just sit at home and take exams. You will be doing internship. And you can take this exam. So passing Part 1 exam doesn't mean that you are a Mrcp degree holder. You need to go through a training. You need to pass Mrcp Part 2, what you call as knowledge exam and clinical exams. When you are in water, you know how to swim. That is the idea. So standing outside swimming pool, you can't be just testing how deep is the water. Okay. So all 3 parts must be finished within 7 years. Most of the candidates, they do finish 3 to 4 years or 4 to 5 years. But of course, there are candidates who lose interest along the way. They stop doing Mrcp training. They leave it there. Okay. But these percentages are very less. Okay, so this Mrcp UK, there are a lot of pros and cons. It's a very popular option in Malaysia. Why not? It's a local track. All exams are in Malaysia. Of course, you can go out and do additional training, come back. You can take the Part 2 exams in UK. Of course, these options are there. Keep in mind, there's a parallel pathway. Parallel pathway means you have a master's program, a very well formal, structured master's program run in public universities, but this is a parallel pathway. You are working in a Ministry of Health hospital. You want to, don't work just for the sake of it. You want to get trained. Okay, so this are the positive aspect of this program. The negative aspect of this is stress coming to complete training on time. You need to complete all these things. You need to complete exams, read for exams. You need to pass the clinical exams. Exam costs. Of course, when you are in the journey, the cost really don't matter. Exam passing rate, the success rate. Supervisors, lack of supervisors, lack of training facility. You are doing a MRC OG and you don't have a training facility where you can be trained under obstetric and gynecology. Okay, these things can happen. So you need to look at this. There could be many of them stranded in this, but there is a way out. You need to discuss, you need to venture out and find a solution. So these are some of the pros and cons of Mrcp UK. This is a degree program, parallel pathway, which you are going to do while you are working as a medical officer in the Ministry of Health. Then there is a formal master's program. But keep in mind, this master's program at the moment in Malaysia is limited to public university hospitals only. Like University of Malaya, UKM or UPM. It's tough pathway to get into postgraduate position. Okay, so There's a lot of waiting period, less number of positions, and more candidates vouching for it. Approximately, there are 800 to 900 positions available in public universities, and there are so many graduates who are coming out. So if every one of them wants to get into master's program in public universities, it is not possible. So think beyond that. There's so many other options. Malaysia doesn't have national level common entrance test yet. Okay, maybe in the future. Okay, so think beyond this. If you have specific plans towards master program, plan for it and work hard towards that. Okay, so why not? Of course, surgical disciplines elsewhere all over the world, it is quite difficult. If you want to be a surgeon or become a specialist or subspecial training in surgical field, you need to put in more efforts, look for more resources, opportunities, funding, sponsorship. All these things are important. Okay. Okay, let us look at Australia UK pathway for post-graduation. Not a very easy pathway. Okay, what I'm talking is candidates who have done MBBS degree from Malaysia wants to go to UK, Australia, do a post-graduation there. There's enormous amount of competition. There are graduates in UK and Australia themselves trying to get into those positions. There are so many medical doctors who are working in UK or Australia and want to do a specialization there. So you are a medical graduate, you want to go to an overseas country and do a post-graduation, you will be facing enormous amount of competition. Many of our candidates may end up as GP, general practitioners, or registrars, or rural doctors. They might not end up doing specialization at all. They would be trapped in the web there, staying overseas outside Malaysia. This pathway, if at all you want to take, you need to complete internship and compulsory MO services in Malaysia. Yes, you need to do that. Let us say you don't do that and you go, you can't do a post-graduation, you want to come back, then it may be difficult for you to get into the mainstream here in Malaysia. So better complete all the mandatory training. And you need to pass mandatory English exams, Professional Linguistic Assessment Board, PLAB exams. PLAB is an entry-level exam. Okay, there are two parts of this exam. Passing this exam will allow the General Medical Council of UK, United Kingdom, to allow you to practice medicine in UK, United Kingdom. And of course, there are state-level medical boards in Australia for which you need to pass Australian Medical Council examination, AMC. Again, passing these exams doesn't guarantee you a specialist training, because many of the candidates who pass these exams, they go there, they end up doing a, what do you call as locum jobs, or else non-training jobs. You are doing a, you are a doctor, but you are not being trained. It's not going to be useful. You may get money, you are earning, but you are not getting trained. So keep in mind, there is obviously a tough competition for these training positions from local doctors, European Union doctors, and even fellow Asians. Okay, much of our Asians are much in competition. So keep that in mind. Of course, there is a US residency program. Okay, very popular, very beautiful program. US residency, United States of America, where they call post-graduation as residency. For this, the candidate needs to pass the 3 exams, step 1, step 2, CK, and step 2, CS. Clinical knowledge, CK, CS is clinical skills. If you pass these 3 exams, you are eligible to obtain post-graduation in US. US doesn't allow you to come directly from overseas and practice medicine. You need to pass these exams. You need to be a specialist. Okay. So these exams are taken during the MBBS years. This is where you need to plan. You can take step 1 exam in your 2nd year of MBBS. How beautiful it is. Most candidates take exams during internship or while waiting for postings after MBBS. But if you take these exams during MBBS, you are at a lot bigger advantage. This residency or post-graduation US is a compulsory. Every medical practitioner in US is a specialist. There will be no MBBS doctors. All are MDs, Doctor of Medicine. Okay, so every doctor is a specialist, and the residency training can be anywhere from 4 to 5 years. And The pathway is quite clear, quite easy to apply and get there. So once you are a board certified specialist, you can practice medicine in US. You can be a specialist in US. If you want to come back to Malaysia, yes, this degree is recognized in Malaysia. Okay. So this is all what we talk about USMLE, United States Medical Licensing Examination, the big thing, the reading for exam, the preparing for exam, and good preparation for a foreign medical graduate like a student from Malaysia needs to score very well. High scoring is very important, and it's not impossible. There are plenty of candidates who are going to US to do post-graduation. When so many people can go, you also can plan for it. If you look at the residency match, the matching means how many of these candidates who take USMLE and pass USMLE get a position, postgraduate position. Okay, almost 1/3 of the stream are international medical graduates. 30%, approximately 30% of the positions are taken up by international medical graduates. There's a lot of opportunity for overseas students to get into postgraduate training in US. So IMU has a lot of initiatives towards helping students, towards facilitating, guiding students towards USMLE. IMU has collaborated with AMBOSS. AMBOSS is a knowledge bank, and IMU is proud to announce that it has collaborated with AMBOSS to bring in preparatory course. Without the course, it's very difficult for any candidate to pass these exams and go to US. So we are helping students. You know, we are not pushing students towards US, but we are facilitating students to pass these exams and keep your opportunities or options open to go to US and do a post-graduation. So it's an excellent opportunity for students who are already preparing for USMLE exams, like current IME students, or who have plans or who want to head to US for post-graduation. Okay, so it is a very nice plan. And this preparation starts from semester 1. Okay, right from the day the student enters medical university, they are given complimentary preparatory program or preparatory course, which can help them prepare for post-graduation. And this AMBOSS program is quite useful. It has a comprehensive knowledge bank. It has it's an online course, and it has question bank which can help students to prepare well as and when they learn IMU medical course. Okay, so that they're not much dependent on their parents. So as soon as they finish their MBBS, yes, they are eligible to get a position in US. How beautiful it is. Okay, so keep in mind, IMU constantly supports and guides students for post-graduation, not only for MBBS. We don't just pull you into MBBS and then allow you to complete the degree. No, IMU supports students further beyond MBBS. Okay, that's very important. The faculty have a very rich experience from various quarters. We have faculty who have graduated from Malaysia, postgraduate specialists from Malaysia, overseas, from India, Australia, UK, US, with rich experience. They can facilitate the students for various different exams. Okay, of course, IMU has interactive sessions, we have mock exams, we have guiding sessions for students who are looking forward for USMLE exams, United States Medical Licensing Examination. But keep in mind, these exams will come during your medical course. During your 3rd year, during your 5th year, you are going to pass this course, these exams. And IMU also has a rich alumni network who constantly keep on coming back and sharing their experiences and their, their how much efforts they have put in to get there. Okay, so that is a big aspect about IMU. So the way forward will be like this. So if you look at the first slide, you're not deviating away from target. You are looking at the target, but your target is something else beyond it. Okay, so way forward is the time to decide on a future path is now, not after MBBS. You can't decide after MBBS. As and when you go through it, yes, you have to do a post-graduation. Yes, I want to be a specialist, and I will find out why, how, and when I want to do it. Gather adequate information. Information is everywhere. I need not say this. Okay, so the Gen X, Gen Y, Gen Z, Information is everywhere. Plan resources. Resources could be time, sponsorship, money, information. Information is a resource. Keep in touch with candidates who are doing post-graduation in various parts of the world. Keep alternative plans open. Don't be rigid. Don't break your head. I want to be a cardiologist. Keep your alternative plans, plan A, plan B, plan C. Do non-clinical masters. Why not? Okay, so you are a specialist. Okay, so now in the era of COVID, there are more demand for virologists, I told you earlier, rather than orthopedicians. There's no alternative to hard work. Okay, you can't just be a specialist just sitting around, loitering around. You have to plan, look forward, have options. Yes, go for it. That is what makes you an ideal medical graduate. Okay, so MBBS is not your goal. The target is much beyond that. Okay, so that is the end of the talk. Hopefully you have got a little bit gist from this talk, and you have been able to gather some information, and let us see if you have any questions, and we will pass on the mic to the moderator to take over from here.
Thank you, Dr. Arun. A very, very good presentation. I really enjoyed the presentation myself. Very passionate examples that you've given as well. So thank you very much. We have lots of good questions, Dr. Arun, and
Yes,
I'm happy to help you to answer some of them, but probably you can take the lead in answering most of them.
okay.
So I think the first question is from Hazel Leong. I think the first question is, what is the intake for medicine in IMU? So if I'm not mistaken, there's 2 intakes in IMU for medicine, isn't it? I think the intake starts off in February, March, around that time. And
Yes,
another one is in
August. Yes, we have 2 intake, and candidates can apply all over the year at different time, and you can go to the IMU website and find the link, and we have 2 intakes in February and August.
Okay, let's move on to the second one. Anonymous attendee. Hi, may I know more about your credit transfer program for MBBS? Can we choose the universities that we want to go to? I think the medical students match themselves to certain partner medical schools, isn't it, Dr. Arun?
Yes, we have a transfer program, and we have a what we call partner medical school program. Students enrolled into this partner medical school program will have opportunity to get into one of the partner medical schools. Of course, they will get opportunity to rank the schools, and the matching process will be there. The matching process and where they end up depends on their performance during the first 2 years. Subsequently, the medical schools also, the partner medical schools in UK, Australia, Canada, they match our students and they rank our students. So keep that in mind. So students will be guaranteed, yes, you will get into a PMS program, but if you want your own choice of partner medical school, you need to score well. You need to be a good, hardworking, and deserving student.
Upon completion of the credit transfer program, the students will be awarded the undergraduate certificate from the partner medical school university, right?
Yes, that's right.
Okay.
So they will get an undergraduate MBBS certificate from the partner medical school. That is where they have completed. Yes.
Okay. So unless they will do everything locally, then they will get MBBS certificate from
Yes.
IMU.
Yes.
Okay. Same person. It's just one whole big question. Very good question. Is it guaranteed that we can do our housemanship in that country of PMS? So far, do you have any students doing their housemanship overseas after completing their partner medical school's graduation?
Yes, what I can say from the experience is, yes, when students go to UK, Australia, they will have opportunity to do post-graduation there itself. But keep in mind, we can't guarantee. The world is changing.
Yes.
In future, how the trends will be. All these medical schools in various countries, they will have specific numbers of internship positions available, postgraduate year, internship year 1 and 2. So we have students who come back to Malaysia, to do internship here. maybe they have personal reasons or some of the constraints. But if you want to know more about the numbers, how many come back, IMU graduates come back from overseas, you can liaise with our admissions.
Yeah. Actually, you're right, Dr. Arun, because my colleague or my classmates who went to overseas or partner medical schools, most of them are still there. Did their internship, housemanship in partner medical school. So they're all over the place. Most of my classmates are there as well. So yeah, great. The third question, what are the most important qualities of a doctor? A passionate one like you, Dr. Arun?
There are so many different qualities. Of course, you can Google. I'm answering the student who candidate who has asked the question. You can just Google and see. Being there should be dedication. There should be the doctor should have ability to serve the needy and all those things. Compassion.
Like you say, Dr. Arun, as well. I think they need to be able to adapt to situation as well, adapt to pandemics. I think every 10 years there's going to be a pandemic or so.
Yes, adaptability, yes.
I think with the news ongoing with stress in house officership and burnout in house officership, I think it's very important for doctors to be able to adapt to their surrounding, adapt to stress, adapt to long clinical hours if there is, and being professional as well, like yourself, Dr. Arun, who gave very good examples in presentations just now. So yeah, I think that's very crucial as well. Let's go to the fourth one, anonymous as well. How do we pay off our living during housemanship? Perhaps because
maybe you can answer.
I think the question, perhaps because housemanship pays too little. I think it's not so bad in Malaysia. I think it's not so bad in Malaysia compared to US, for example. The study loan in US is horrible. But then again, the doctors in the US pays very well. But then again, they have lots of legal lawsuits, for example, as well. So to answer the question of how do we support our own living as a housemanship, I don't think our housemanship in our public hospitals or the Ministry of Health pays that bad. We are able to survive. In fact, speaking from experience, we do pay back our study loans very, very fast, depending on how fast you climb up the career ladder as well. So it's not difficult. I would say it's not even near difficult. I think it's doable, and because housemanship doesn't pay that little. Of course, it depends on what is your cost of living as well, isn't it?
Yes. Well, what I can also add here is after your MBBS, the moment you are in internship and MO medical officer, you start earning. You start earning. You start contributing back towards the family, managing your expenses. Especially in US, I know the residency program in US pays you around $50,000 to $60,000 per year. Of course, this amount is quite less, small compared to what a specialist should be earning. But this is quite manageable, having a single room house, having a second-hand car in US, paying the mortgage and all those things. So one thing is the better aspect is this: as soon as you are an intern, you would not be depending on your family and keeping how much lavish your lifestyle is.
Yeah, that's good. We'll go on to the next one. The next one is anonymous as well. Dr. Arun, may I know the right route to take MRCP exam after my undergraduate studies? Do I have to go to UK to take the class, or I can take it locally?
Yes, Dr. Arvind, maybe you want to share that?
Yeah. I'm happy to answer that. So postgraduate examinations are very different from undergraduate examinations. Basically, we work every day. That means we do not have classes, we do not have lectures. It's all based on it's when you work every day, and then that's where you generate your knowledge. That's where you accumulate your knowledge, your clinical competencies. Your postgraduate clinical examinations are based on your work done during your internship and during your day-to-day activity. So it's very, very different. So there's no classes when you talk about MRCP or MRCP-CH. I'm not so sure about pathology. I don't have classes as well today.
No, in pathology post-graduation also, they don't have classes, they work and they need to do seminars. In fact, they need to conduct seminars, they need to do what you call a slide sessions, slide reading sessions. Likewise, it goes in the masters, like non-clinical masters. But of course, doing MRCP in Malaysia, candidates need to maintain logbook. Logbook is so essential. Evidence of training, and also getting appropriate approval from supervisors that you have undergone training, the checklist, all these things will be there.
Correct.
But of course, for the benefit of all the viewers, keep in mind that there are plenty of training modules available, online modules available. So nobody is stopping anybody like not to go through these modules. So while you're doing MRCP, you want to get trained in any of these smaller learning aspects. So there are a lot of like Coursera's and all those things. You can improve your skills.
Yes, correct.
Yes.
Can I study my MBBS degree in Malaysia and take my specialty training in other countries? Yes, I got my MBBS in IMU and I did my specialty training in the UK. I sit for my exam in Great Ormond Street Hospital in London. So yes, in fact, if you want to do your MRCP pathway or MRCOG or MRCPCH pathway, the UK Membership Royal College are conducting their exams locally as well, but you are awarded the Royal College certificate. So yes to that question. I think the next one is from a parent, Dr. Arun. So good morning, doctors. I'm Dr. Caroline, a GP in Subang Jaya. My daughter is interested in genetics research. She will be completing her A-levels in Sunway College coming June. How do you go about this, or how best to go about this?
Okay, it's a very interesting question. Yes. First of all, I would like to appreciate that you and your daughter have decided, at least you are focused that want to do genetic research. It's up to you whether up to this candidate, whether she wants to do in a core research without being a medical doctor, like a researcher, being a scientist. Then she need to go through program like biomedical science, masters in medical sciences in genetic research, and further she can do a PhD if available. Of course, these options are available so many different places across Malaysia, overseas also, in Singapore and Australia. So they need to prioritize that. So to start with, maybe she could get into a biomedical science program in a suitable health sciences university. And subsequently, she will have to get into research with masters. And biomedical science program will be 3 to 4 years or 3 years. Masters will be 2 years, and subsequently she can have her own pathway in genetic research. But if she wants to be MBBS doctor and genetic research, then it will take a little bit further time, because 5 years MBBS, then 2 and 2 of clinical training. Then she has to get into masters in science for genetic research. The only advantage is she is a practicing medical doctor along with genetic research. So her capacity, her job profile will be something different.
And IMU also offers BMed science as well.
Yes, biomedical science and Bachelor of Medical Sciences. Yes, IMU has this Bachelor of Medical Sciences where first 3 years the candidate will do a bachelor's degree program, and along with research. Yes, yeah, and they will continue either locally or overseas with MBBS program. So the advantage here is by the time they complete MBBS, they get 2 degrees, Bachelor of Medical Sciences and MBBS degree. But of course, they can't be a genetic research specialist. They need to further do masters. Okay, so for more questions, like especially on these things, we'll be quite interested to answer you, especially Caroline Lum. You can come to the IMU Open Day, virtual Open Day, and we can have a mutual discussion. Yes.
Okay. Next question, is demand for doctors in Malaysia increasing or decreasing nowadays? I think the demand is always going to be there. It's going to be increasing. Look at every day, people are complaining about how doctors are being overworked, etc. But the thing, of course, is how the policies are being implemented and how much the recruitment is going to be taking place. Of course, that is a whole different story. But all over the world, the demand for doctors will always be there. Population is getting bigger and bigger.
Yes. Yeah, and also keep in mind population aging. Much of the senior doctors are aging, and then the demand is always there. Of course, you will see media reports of 4,000, 5,000 doctors, more doctors. But if you properly see how do you want to go through your career, so you can find a demand, appropriate demand. Yes.
Dr. Arun, by Lee Wan Hun, Dr. Arun, may I know what are the pros and cons for MRCP versus the USMLE?
Yes, MRCP pros and cons by individually I have just shared in my talk. For USMLE, there are so many pros. Number one, the training program is so short. After 5 years, you need not do an internship in Malaysia. If you pass all the exams, you can go to US and do 4 years of postgraduate training. So within 9 years, you are a specialist, right? That's the advantage of it. MRCP will take a little bit more time. Number two, the chance of you getting your own specialty, what I want to do, is very high if you score very well. I want to be in surgical specialty. Yes, you score very well. You apply in US medical schools, US universities, and you might get it very well, which could be difficult elsewhere. Number three, the subspecialty training is quite easy in US. After you do, let us say, pediatrics, you want to do pediatric cardiology, probably your openings will be quite easy in US compared to elsewhere. So again, there are a lot of other pros and cons, the lifestyle, the training, the expertise across the different countries. So things are quite there. The difficult part of USMLE is going there. Exactly, you are going 12 hours of time difference. You are going to the other part of the world, staying far away, different culture, adaptability, so many things.
Yeah. And the best way to make any decision such as this is to talk to as many people as possible.
Exactly.
That would really help as well. And the next question, while waiting for housemanship at the meantime, what can we do? There are a lot of things that you can do after graduation while waiting for housemanship. I think the housemanship period waiting is about a year or so now, and students take the opportunity to serve the population, serve the underprivileged society citizens. They travel around the world. I think that's the best time to have your own time because you've been studying so much, you've been sacrificing so much for the 5 years of medical school, spending time with family. These are important. Of course, you can start studying for your part one as well. I think those are favorite things to do while waiting for housemanship. I think it's a very, very good time. After you begin your housemanship, you wouldn't have any more time, quote unquote, time anymore for yourself. So that's the best time actually. So Eunice asks, could you tell us a bit more about the IMU transfer program, Dr. Arun?
Yes, Eunice, in the context, in the view of time limit for this talk, what I will suggest is please attend our IMU Open Day. There will be faculty there who would engage you and tell you more in detail about transfer program. The IMU Open Day is on 24th. And so you will have a very clear understanding with, giving you an idea about transfer program.
Yeah.
Yes.
I think to talk about it, virtual open day is on 24th of January, 10 a.m. to 4 p.m. It's online, and you can log on to www.imu.edu.my/open-day, and the highlights will all be there. So I think it's a chat box right now. We are happy to discuss more and answer more of the questions there. The next question from Cindy asks, excuse me, Dr. Arun, about the USMLE. If you pass, are you free to select the location of your residency?
The location of the residency depends on your applications. Of course, what many candidates do is they apply only for universities in the East Coast or only in the West Coast, and they put around 100 applications. The candidates do like this. I have passed all USMLE, I've done with high grades, I have these credibilities, and they apply to universities. And universities will look at the candidate's profile and they will call for interview. So yes, you have a chance. Yes, let us say if you want to get into a very particular university like Mayo Clinic, I want to go to this medical school only, then you will have an opportunity to go there and do some attachment, observership, be familiar with the people there so that they could choose you. That's a very important part of USMLE residency program. where there will be a ranking and matching process also.
Mhm.
Yes.
Next question. Will the classes in February intake 2021 start online or face-to-face? I think they're talking about semester 1 students
Yes.
will be starting in February.
So as of now, we will be, following the strict guidelines from the Ministry of Health as well as higher education. So please look at the guidelines. If the ministry allows us, the government allows us to do face-to-face, yes, we are doing that. But of course, some of the larger gathering will all be online. Like large lecture sessions will be online. Some of the other teaching learning sessions, like clinical skill sessions, would be face-to-face. Of course, with all social distancing, mask, hand sanitizer, all these things.
I think this is a related question, Dr. Arun.
Yes.
How would the study be planned for international students given the COVID situation if a student joins into the February 2021 intake?
Okay, so as of now, all the guidelines are there on IMU website, and then if a student is already enrolled in IMU, the student services are sharing the information about how international students are dealing with the current situation. As far as I know, the guidelines are the students are asked to come back. It is obviously important for students to be within the country and go through the training program and staying in the proximity of IMU and then coming to face-to-face sessions. So keep in mind, as a medical graduate, students must go through a mandatory clinical skills training sessions. So of course, the online sessions can't fulfill these things.
Correct.
So we are hoping the students to come back and then get through the sessions.
Yes, in fact, in clinical school, we still do teaching in the hospital despite of the Ministry of Health instructions. So the campus is closed, but we still conduct our teaching in clinical hospital. So the next one is from Sarita. I'm trying to understand the structure of the question actually. Is India State Board Class 12 recognized for IMU admission? In PMS program, is the internship held in partner country? What about USMLE training if student is in partner country?
Okay, Sarita. So what I can say is, yes, Indian State Class Board, 12 class, like a CBSE, ICSE are recognized by IMU admission. You can go through the admission requirements in the brochure. And of course, you can attend the IMU Open Day and then check the admission requirements. Yes, in PMS program, the internship is held in the partner country. Yes, as of now. But just in case in future the partner country is not allowing or doesn't have adequate positions, the candidate may have to come back to their home country, to do the internship. So that's not guaranteed. What about a USMLE training if student is in the partner country? USMLE training, even the students go to partner medical schools, they complete the MBBS there. They can still have an opportunity to go to US and do a residency there. Of course, doing a residency is 4 years post-graduation in US. It is irrespective whether the candidate has done from Malaysia or India or one of the partner medical schools.
Okay. Next question. So there are two pathways to pursue MBBS in the university. I think the local pathway where 5 years is in whole Malaysia, and then 2.5 years in partner medical schools and 2.5 years in Malaysia locally. Is it true that I would love to know if it's flexible to choose between the two pathways? I think it is flexible to choose the two pathways. I think we asked them during the admissions which pathway to choose. But can students change the decision after the 2 years or after the first 2.5 years?
Okay, this is left to the guidelines by the university. Of course, there are some guidelines. Usually, we don't advise students to change options from local track to partner medical school track. And keep in mind, the students must be eligible for partner medical school track because each of these partner medical schools have their set guidelines for student entry. So if all the things fulfill and if there are positions available, a local track candidate can change into partner medical school. And it's a vice versa. If a student from who has enrolled into partner medical school program wants to switch to local program, it is not automatic, provided there are positions available here. And keep in mind, the local track program is also always full most of the time. So in this case by case basis, the school could assist students if at all needed, but it is not guaranteed.
Okay, all right. And of course, after the 5 years local program, like one of my colleagues who, after MBBS local program, they did USMLE examinations. I think to answer the question there that we had as well, is possible. So as a PMS student, if you choose, I think Singapore Medical Council recognized university, will the degree be recognized by Singapore? I don't know. I think we have to look back at the university recognition by the SMC Council again. Not very entirely sure of this, because perhaps the best way is to get in touch with personally with us via email, or come to a virtual open day and somebody will address the question. Or in fact, maybe we can get back to you on that as well, if you're not so sure, because you're not so sure in that as well. What I know is certain countries, we are like Sri Lanka Medical Council, we are easily recognized there. But again, not very sure about the Singapore Medical Council one. Can we work there after graduation? Yes. Again, depends on scenarios, depending on pandemics as well, and depending on how things change in the world with Brexit now. I think PMS, I mean, Brexit, but they're very much political about influx of international migrants, things like that. Things change, but like I said, my colleagues, I think most of them who went to partner medical schools are still working there. Can I know about the clinical rotation in the US? Will I be able to choose the hospital? Do I need to meet any academic requirement? I think Dr. Arun, you answered this previously.
Yes, that's right. That's right.
So we're happy to play back. I think it's this session is recorded, and we are happy to give the link to the records, these recordings as well. What are the chances of me transferring to partner university of my choice? I think Dr. Arun, you answered that as well, because it's a matching. It's a matching thing. So depending on how your performance in the first 2.5 years in medical school, the better you perform, I think the better you are matched to your choice of partner medical school, isn't it?
Yes.
Right. Next one. Hello, can I ask how many spaces are allocated for each universities in the UK and Australia for the credit transfer program each year?
Yes, for this, the number of positions available at each of the partner medical schools will be shared with the students during their second year. They will come to know, and these positions could be around 4 or 5 in each universities, or 8 or 10 in some universities. So it can be changing year to year. So when the student enters a partner medical school program, the number of positions will be locked, and that will not change for that group of candidates. So let us say like University of Nottingham is allocating around 8 positions. Yes, that will be there for that cohort of students. So the exact number of positions available will be shared with students, partner medical school students. So they will have opportunity to rank the universities and match it during their medical course, second year. Yes.
Okay. Next one. Does overseas partner university accept students with foundation of science? I heard they only accept those who did A levels. Again, I'm not very sure of the answer to this question. Dr. Arun, do you know?
You need to clarify. I think the candidate need to clarify this during the IMU open day. There will be admissions. We have students who have done foundation in science from IMU who have been accepted by the partner medical schools. But if you want to know more details, like what foundation program, where, and what are the criteria, you need I'll advise the candidates to come to the open day and then clarify, because we need all these details where they have done it.
Yeah, and the admissions team will be there definitely in the virtual open day. That would be very helpful, isn't it? All right, Sarita asks, okay, Sarita again. If the internship is to be done in our home country, which is India, does IMU help with getting internship? Talking about India.
Sarita, no. So IMU doesn't help in getting internship in India. So it is up to the candidate to get eligibility to do internship in India. IMU does the training, 5-year training. If you are looking at local program, subsequently the candidate needs to pass, so there's a MCI exam, Medical Council of India exams, and then apply for doing internship. There are many candidates like this who are getting overseas degree and coming back to India and doing this. So I hope this is helpful for you. But again, if you have more details on this, But keep in mind, international students, like in your case, you can't be doing internship in Malaysia. Even though you do a 5-year local program, you can't be doing, you need to go to India and do internship. Another option is, why don't you go to US pathway, complete MBBS from here, go to US and do a residency in US, and then you can come back to India and be a specialist.
Next question. Hi, doctors. May I get a slight idea of a route to becoming a neurosurgeon locally? Sure. I think I have a classmate who is a neurosurgeon now. I think the pathway is fairly straightforward for neurosurgery, because I think they need to be hands-on. So after MBBS graduation, full local program, you do your housemanship, you do your MO-ship, medical officer placement, and then during the medical officer phase, you'll be allowed to apply for the master's program. So the master's program of the neurosurgical program is a 4 years program. Complete the 4 years program, and then you'll be gazetting as a neurosurgeon. So it's not that very, very long. That means you don't have to become a surgeon first before you subspecialize to a neurosurgeon. So it's a direct pathway in Malaysia to become a neurosurgeon. So yeah, very, very high demand. And my classmate who's now a neurosurgeon is very, very busy. So she's doing very well. So may I know, to pursue specialization, how high is the cost? Actually, it depends on which pathway you're taking. If you're taking the master's program or the membership program. MRCP, for example, which what I did, it costs a little because you have to pay for the examination fees. Most of them you have to be prepared. Books are important, so these are the costs that's applicable. You don't have a tuition fees because the MRCP is a self-studied program. Compared to the master's program, it will go attached into local public universities. So how high is the cost? It depends on which pathway you want to take. The thing is that the cost is not the main thing here, because once you do a house officership and medical officership, you're able to pay the tuition fees anymore. But now as undergraduate, tuition fees are mostly reliant by your parents. So it's very different of costing when you talk about undergraduate and postgraduate. In postgraduate examples, most of them are paid by yourself candidate. So if I have to give a ballpark figure, MRCP practically just pay for the exam fees, and that's about 10,000 ringgit. It's not depending on how many times you pass or how many times you fail. Master's program also is not 20,000 ringgit. I think that is not significant amount once you graduate. So hope that answers your question.
Yes.
Yeah. So next question, we're trying to chase time here and trying to answer everybody's question. Hi, may I know your view about medical biotechnology and biomedical science? I think Dr. Arun Kumar also answered this as well.
Yes, we have these courses in IMU. It's quite a wonderful course. So again, in view of the time, we would not be answering these things here. Please come to IMU Virtual Open Day, and you will get to talk to medical biotechnologists and biomedical science experts, and get to know about the career pathway. Okay, so I guess I think in the view of time, we need to wrap up the session, and maybe there's so many questions here which have come up. Myself and Dr. Arvin will take turns. Maybe we'll answer some of the questions, type the answers, and answer them. Yes. So maybe we should end the session in view of the time, I guess.
Oh, yes. I think we better do, because I think
yes.
we passed the time. But
right.
audience, thank you for coming again. I think we need to end this session right now. Sorry if we didn't manage to keep track of the time, because there are so many good answers, many good questions.
Yes.
I was so engrossed in. So we'll track the answers and we'll keep you updated. And please come for our virtual open day that will be held on 24th January, this Sunday, from 10 a.m. to 4 p.m. Again, the website is www.imu.edu.my/open day. And there's going to be career and education counseling, live chat with faculty members. You can ask them about all these very valid questions. And also, you can enjoy application and registration fee waiver of up to 800 ringgit for all programs except for medicine and dentistry. Of course, terms and conditions are applicable. So again, my huge thanks to Dr. Arun for a wonderful presentation, very, very passionate presentation. I myself was engrossed with it, and very good questions from audience. We will continue to type the answers here, and I see you in open day. All right. Okay.
Okay. Thank you, Dr. Arun. Thank you very much for moderating the session. And it was very nice audience with so many questions. Thank you very much.
Okay.
And have a nice day. Have a safe time during COVID.
Okay. Take care. Bye-bye.
Bye.